You're watching Facing Seasonal Depression by Dr. Lissa Gall on Resonance Wellness TV, part of my Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. Hello and welcome to Facing Seasonal Depression. My name's Dr. Lissa Gall, and I'll be your guide this evening about this exploration of what happens when the sky darkens in winter and the inner light dims. As usual, this presentation is given in the context of the Alleviate branch of the Whole Life Medicine model. And when we talk about seasonal depression, we are examining root causes, missing ingredients, and problem-specific programs. But the question of mood is a large one, and certainly mood is something that's complex and can involve multiple categories of both alleviate and align, which is more about inner exploration. And in this lecture, we're going to examine the seasonal affective disorder, talk a bit about what is known about it, and try to give some practical suggestions for helping it out. So, seasonal depression, to start with, or seasonal affective disorder, is known as SAD. That's convenient, SAD. It's a type of depression that's related to changes in seasons. And affective actually refers to the affect or the mood. That's what that word means technically. And the condition typically begins in the fall and continues into the winter months. And it typically lasts around 40% of the year for people who suffer with it. Approximately 2 to 6% of Canadians will experience SAD in their lifetime in its full form. And that form is really more than just the winter blues. About 15% of Canadians will have a mild form of SAD that leaves them slightly depressed but functional. About 10% of all people with a diagnosis of depression have seasonal affective disorder. It's more common in people who have a family history of depression or bipolar or SAD. And women are more likely than men to experience it. Some research actually implies that 9 times the number of women have seasonal affective disorder. Symptoms can appear at any age. It most commonly appears between the ages of 20 to 30. And typically the further one is from the equator, the more at risk you are for seasonal depression. So that makes Canadians more likely to experience it. So if you contrast in the US, 1% of people in Florida have seasonal affective disorder, and 9% of people in Alaska do. So you can see that it's at least partially related to where you are on the planet. And SAD can occur between spring and summer as well. In this case, it's often associated with allergies to airborne pollen. So we're going to talk more about that in a minute. The DSM-5 criteria for having SAD, so that's the Psychological Disorders Diagnosis Manual. It actually, the definition is depression that begins and ends during a specific season every year with full remittance during other seasons for at least 2 years, and having more seasons of depression than seasons without depression over a lifetime. So it's a very particular definition. And the symptoms of seasonal depression are really consistent with those that occur with other forms of depression. Unique symptoms are associated with carbohydrate cravings, increased appetite, excessive sleepiness, and weight gain. And those common symptoms can range from feeling depressed most of the day or nearly every day, losing interest in activities you once enjoyed, having low energy, feeling hopeless or worthless or irritable, a loss of interest or pleasure in activities you used to enjoy, feeling sluggish or agitated, having difficulty concentrating, difficulty sleeping or oversleeping, and like I said, carb cravings and weight gain. And sometimes people also become suicidal. Specific to winter onset seasonal affective disorder is really the oversleeping and the appetite change, the weight gain and the tiredness. And in summer onset of seasonal affective disorder, there may be more insomnia type symptoms with a poor appetite and weight loss, and agitation or anxiety, which is kind of interesting. They're almost the polar opposite. Researchers from the University of Maryland have actually found that the depression that worsened during the peak pollen periods in people with both bipolar disorder and active pollen allergies. So the worsening of depression after high pollen exposure wasn't actually fully explained by the severity of the person's allergy symptoms. And so rather than a lack of sunlight, the spring onset seasonal affective disorder may be linked to high levels of inflammation, promoting chemical messengers that are called cytokines. We have had discussions about cytokines in the past when we've done lectures about inflammation, but it's quite interesting to know that there's actually a spring version, and that it's also ends up creating these huge mood changes. Now, this type of depression, the seasonal affective disorder, was actually not really identified until 1980. And it was by a doctor who was named Norman Rosenthal. He was a South African doctor. He is a South African doctor who moved, I think, to New York. He realized that he felt really much less productive in the winter than in the summer. And it was marked enough. He didn't realize it at first, but after a couple of years, he realized there was quite a difference in mood. And so he teamed up with scientists that were researching melatonin and circadian rhythms. And they showed collectively that this type of depression had a correlation with the seasons. And the exact cause of it actually remains unknown. But there are several possible causes. One of them, obviously, the circadian rhythm or biological clock could be disrupted by the changes in sunlight, and that could lead to the feelings of depression. So for people with seasonal affective, the thought is that maybe the circadian signal that indicates that seasonal change in day length has been found to be timed differently, so it makes it more difficult for their bodies to adjust. That's one possible cause. The second is that there's definitely neurotransmitter changes. Serotonin in particular has been targeted, like many other mood disorders. So low levels of serotonin already affect mood, and they may also be playing a role in seasonal affective disorder. Reduced sunlight actually can cause a drop in serotonin that could be the trigger. And then we also look at melatonin. So melatonin is a sleep-related hormone that's secreted by the brain, and it plays a role in sleep patterns and also mood. Low levels have been linked to seasonal depression, and a change in season can really disrupt the balance of the body's level of melatonin as well. Now, there's also a couple of other potential explanations for SAD. So you can also have trouble with other neurotransmitters. So there's multiple transmitters that if you show that there's depletion or dysregulation in, that they reverse the effects of therapy for SAD patients. And also the depletion or dysregulation of thyroid hormones is fairly common in SAD patients. So both neurotransmitters and the thyroid hormones also exhibit seasonal variation in a healthy adult. So the carb craving characteristics of SAD patients is also consistent with clinical low thyroid or hypothyroidism. And there have been changes in levels of TSH in SAD patients that are undergoing treatment with light therapy, which is interesting correlation, and administration of low doses of thyroxine, which is one of the treatment thyroid hormones, has been shown to reverse depressive symptoms in healthy subjects exposed to prolonged darkness in an experimental way. So it isn't always what you exactly think it is. And it's worth also doing some thyroid hormone testing if you feel like this is something that potentially could be affecting you. Now, there's a number of different risk factors, some of which we've already talked about. And what we had said originally was women are more likely than men to experience this. And the condition actually occurs more frequently in younger adults than older adults, interestingly. Additional factors are you already having a major depression or bipolar disorder. So symptoms of depression may worsen seasonally if you already have that condition. And so in essence, it would be a complicating factor to your depression picture. And family history. So people with SAD are much more likely to have blood relatives with SAD or other forms of depression. And also, there's times where the risk factors are not always obvious. There's actually something called a seasonal pattern assessment questionnaire that can really help diagnose the condition, because sometimes you just don't think about the fact that there could be seasonal variations in some of the things that you are experiencing. In my experience, most people are not great journalers of what the symptoms are like over the year. So unless somebody's kind of accidentally clued into it, sometimes we need to actually have them do some questionnaires to figure that out. Now, one of the biggest therapies for seasonal affective disorder is actually bright light therapy. And this particular picture is showing you a particular bright light therapy unit that comes from Feel Bright Light. And in essence, what these are, so the treatment for seasonal affective disorder is using bright light because the decreased daylight appears to trigger SAD. So you're using bright artificial light first thing in the morning from early fall all the way through to spring. And you can buy one of these light boxes that are basically emitting full spectrum light. So it's similar in composition to sunlight, except for that usually they filter out the UV rays. But it's actually about 10,000 lux of cool light daily during this whole season. And this is about 20 times as great as ordinary indoor lighting. So this is quite bright. This isn't really happening here, but in Scandinavian countries, people will actually go to light rooms where you have the light all around you, but a little less direct, and kind of evenly distributed around your whole body. And so a bunch of people can basically sit in this room. And light therapy is actually effective it's estimated up to 85% of diagnosed cases. Those percentages kind of change depending on how significant the depressions actually are. But in essence, what you're doing is you're mimicking sunlight. And you can also have adverse effects of this. I mean, obviously, they're usually less severe than those associated with antidepressants, but you can get eye strain from this. And this is the reason why they're doing it in the rooms with the indirect lighting. So it's still bright, but it's not shining right on you. You can actually get ocular changes and abnormalities. You shouldn't actually normally use it with drugs that are photosensitizing. So lithium is an example of that. There's antipsychotics that you can't use with light therapy. And some antibiotics actually also make you more light sensitive. And it could create an interesting rash if you do this at the same time. And sometimes it's aggravating to people, especially the first couple of days of treatment. And like I said, the use of it is really longer term. So we're talking about months. We're not just talking about, oh, you just did this for a week and now everything's good. But it's obviously pretty powerful stuff to get an efficacy rate of up to 85%. So I thought we might want to just take a quick look at light as a process. And I want to show you something that you might be surprised by, or if I've never talked to you about this before. So on the top here, we have a molecule of chlorophyll. So chlorophyll is the compound in plants that is responsible for responding to photons in the that come in contact with leaves and capturing the energy of those photons or light particles and producing energy out of them. And what you can see on the bottom here is hemoglobin. And I always think it's remarkable when you really look at it to see how similar these molecules actually are. So obviously in the middle of chlorophyll, we have a little green dot there. That's magnesium that's in the middle of the chlorophyll molecule. So that is the plant respiratory metal. It's magnesium. And hemoglobin, which is here at the bottom, the respiratory metal in the middle is iron. So it's shown there as a little red dot. But as you can see, these are light sensitive structures, and your own hemoglobin is also a little bit light sensitive. And why I wanted to introduce this was to introduce the concept of light as being a process that's within every human being. Not just, you get out in the sunlight and you get skin cancer, or you go out in the sunlight and you just make vitamin D. but that it has a deep and profound effect on you inside. And we're going to see some examples of therapeutically of interactions with light and compounds that I think you're going to find really interesting. So I just want you to kind of pack this away, but really, as you can tell, obviously you're going to have a lot of hemoglobin in your skin running through the capillary beds, and they're probably also going to be light sensitive. And it wouldn't surprise me if eventually there's more known chemistry about that. Now, the next slide also shows a little bit of aspect of light processes. And this is a fairly standard diagram talking about how we use UV or UVB rays in particular from sunlight to convert cholesterol eventually to active vitamin D. And so what you'll see here is that in the skin, you have a fine layer of fat underneath your skin, ideally. And there's the compound 7-dehydrocholesterol there. Now, this is spelled incorrectly here. Sorry. That's a bit confusing. But in essence, you basically make a pre-vitamin D by having cholesterol acted upon with light in the skin. And then that pre-vitamin undergoes a number of transformations. So this diagram also shows that you can get dietary sources of both D2 and D3. So these are plant and animal versions of vitamin D. And that all of them eventually end up in the liver, where you have a first conversion to 25-hydroxy vitamin D through a specific set of enzymes. And then you also have a conversion in the kidney to get the final activated results. So it's not just you take the vitamin D and you just incorporate it very easily. There's actually quite a long process to this. And I've had lots of questions over the years about how much vitamin D should I take? And usually I answer that question by saying, you can take some vitamin D and you'll probably store it, and you might even be able to use some of it. But the most important part of vitamin D is the whole process that it actually takes inside of you to create that. And it's going to be more complex even than that what we're seeing on this slide, where there's multiple tissues involved and there's several conversions. I have the sneaking suspicion there's quite a few other aspects of that. And like I said, we're going to talk about that in a second, but I thought I would just review that in case you've never seen this before, or you didn't realize that that was the case. Now, there are a number of different natural solutions that we're going to talk about today. So in addition to light therapy, there's, which is very clinical. I mean, this is something that you can usually get insurance to cover if it's prescribed, a light therapy box. But there are several science-backed solutions that you can use for treating symptoms. And if the symptoms are severe and impacting your quality of life, you should speak with your primary care, because you do want to get adequate care for this. And if you're currently on medication for any condition, talk to me or your own physician about adding natural remedies to help these symptoms in combination with that. So we're going to talk about a couple things today. The first one we're going to talk about is a dawn simulator. So I don't know how many people have heard about a dawn simulator, but this is actually something known as a wake-up light. And so it does help relieve sad symptoms. And what it does is it produces a gradual light. So it's like a wake-up light alarm clock. And so instead of waking you up abruptly with an alarm, they actually simulate the rising sun, and it's providing a light that gradually increases in intensity. So the emitted light gets brighter over the whole half an hour prior to your wake up, and it can be accompanied by all sorts of sounds in the background or exercises. Some of them have built-in like breathing monitors and things. And in one study, researchers found that dawn simulators can be almost as effective. So they got a 47.9% improvement as a light therapy box, which in their study only had a 57.1% improvement for people suffering from diagnosed SAD, and they only used it for about 2 weeks. So additional research other than this study has found that dawn simulators increase in athletic performance. They can enhance cognitive performance as well as lift your mood. And in essence, you can also help your body gradually stop the production of melatonin. So remember, melatonin is the hormone that makes you feel tired. So if you slowly stop that production before you wake up, you feel more refreshed when you get out of bed. So most people find it easier to get out of bed if they use a wake up light as compared to a regular alarm. It's really ideal for waking up during dark mornings because when you're getting out of bed before the sun comes up, a wake up light can at least help adjust your natural circadian rhythm. And a lot of people who suffer from seasonal affective disorder also find a wake up light can help minimize symptoms. So we're starting to see like little indicators here that there's aspects of this. Now, I just want to mention that inside of people's houses, I've seen some pretty crazy lighting strategies, meaning that it's really important to have, like, if you're in your house in the day, and especially if you're working out of your house in the day, situating that workplace near a sunny window or in a sunny room with good lighting is great. And overhead lighting is fine in the day, like the ones that are shining down from the ceiling. But I've also seen that people have this tendency late in the day to not shut those things off, or, I've seen lights in my neighborhood, like the blazing living room lights at 10 p.m. at night. It's really not good for your physiology to be under that much bright light all into the evening as well. And really, from a physiological perspective, when the brain is signaled by having bright lights overhead, it's like having the bright light of the sun above you. And in the evening, that's rare in most places in the world. Obviously in Alberta, in the height of summer, we can be light in the sky until 10, 11 o'clock. That's not typical in most places in the world, right? It helps us in the summer. It doesn't help us in the winter because we get the opposite. But in your house in the evening, lights should get softer, and you should be putting on the lower types of light. So things that are even more on the floor, if you really have sleep difficulties or sleep-wake difficulties. And then the tone of them should be in the red, orange, yellow range. If you have the bright white in the evening, or if you're using the computer in the evening with the blue light on, you can actually get little apps on your computer, or if you have like a Mac, Night Shift is built in. I think it's built in on a PC as well. Phones have that as well. You can even get an app that will time it to a better circadian rhythm for your area. And so when you do that, you're just augmenting the normal physiology instead of interfering with it. So easy things to do. And these dawn simulator lights, like you can go and get a nice one at Shoppers Drug Mart or London Drugs. They have like the Philips model ones. Those seem to be quite good. And they have actually some research to back them. And they probably run you about $200. But if sleep-wake cycles are an issue for you, it's an easy way of starting to incorporate the normal physiology. Now, if you can at all, of course, in the day, if that tiniest ray of light is peeking out, it's really worthwhile getting outside. Getting out during the day as much as possible to take advantage of any sunlight is really crucial for people with SAD. And even if it's cold, just bundle up, try to get as much natural light on your face as possible. Maybe break up your work day with an early afternoon walk. It's a little harder to get a lot of skin sunlight here in winter, obviously, unless maybe you ski in the sun. There's lots of light that comes with that. Although nowadays we all have helmets on and big goggles, so it's like a half a face. But if you have a chance to sit down on the side of the hill with your skis, you should do that. And like I said, if in addition to getting outdoors, just keep those curtains and blinds open when you're in the house to let in a lot of light. According to the University of Michigan Depression Center, the brighter the environment, the better. And in my experience, I've also seen that sometimes depressed people have a tendency to close all the windows. Somehow, like it's just like they almost feel like it's the antithesis of their mood, and they don't want to open it. But it's really important if you can get that bright light in improving your depression symptoms. And like I kind of already alluded to, there's a potential here for vitamin D deficiency. Um, we have two forms of vitamin D in the diet. So vitamin D2, that's found in certain types of mushrooms, and D3 is found in oily fish and fish liver oil and egg yolk. It's a fatty vitamin, like vitamin A is and like vitamin E is. So if you suspect your vitamin D levels are low, you can always have your physician try and run a screening test. I know that's been a bit challenging in this province because it's a very expensive test. They've been minimizing its use. But if you have me as your doctor, we can certainly run that test for you. And SAD patients in particular are frequently found to have lower levels of vitamin D. I mean, that's not true of every one of them because there can be multiple causes, like I said. But, it's harder to get vitamin D in this climate. It's harder if you have a darker skin color. And certainly low levels of vitamin D are associated with depression. But like I was saying before, also, that kind of quality of inner light is also important. So if there are things that you are having difficulty with where you're not finding that inner brightness, sometimes it's really, really need to address those pieces as well. But there is some evidence that taking some vitamin D before winter sets in can help prevent the symptoms of depression. It's not a full-on cure. It's certainly not nearly as effective as using bright light therapy if you really have a problem, but it's something to consider. Now, another thing I thought that was really interesting that I saw in the research was the effect of negative ions. So negative ions exist in nature in lots of places. So obviously we get that from ultraviolet rays from the sun. We also get it in discharges of electricity in the air after thunderstorm or lightning strikes. Wherever water is colliding with itself, like a waterfall or the ocean shore. And it's produced as the part of the normal growth process for a lot of plants. Now, this picture is actually a picture I took of Hawaii when I was last there. I just thought, oh, this is a good time to use this beautiful waterfall picture I haven't been able to drag out for any other presentation. So, lots of people have that feeling of being more relaxed and calmer at the side of water. And I don't know how many of you are on the Facebook feed, but I was recently doing posts about, what sort of things that you feel grateful for and what kind of environments you feel grateful for. And a lot of people mentioned water and rivers, waterfalls. And I think it's a lot of the time it's because we have this feeling of the negative ions around us. And there is a notable effect in people with depression with negative ions. Now, if you have a normal mood, it's not going to have a huge impact on your general mental health. But if you are depressed, hours of negative ion exposure can reduce symptoms of depression. So like high levels of exposure people will record lower scores on surveys of depression symptoms. If you have a shorter duration, it will definitely even positively affect the seasonal depression, which is interesting. And so lower levels of exposure, like just 30 minutes or so, were only enough to help people affected by mild SAD. What's interesting about negative ions is they clean the air. So they will pull contaminants out of the air and drop them to the ground. And so there's a lot of evidence that over the last 100 years, there's evidence that shows that it can regulate sleep patterns and mood. It can reduce stress. It can boost immune system function. It can increase your metabolism of carbohydrates and fats. It can kill or inhibit growth of bacteria and viruses and mold species in your house, including things like E. coli and Staph aureus and the bacteria that causes tuberculosis. So if you get an ion generator, that you can actually get these to plug into your wall, and you obviously have to look for one that has a fairly high flow. They actually did a study that plugged in an ion generator beside somebody who was sleeping on a grounded conductive bed sheet. I don't know if you remember having discussions about this in the past with me, but you can get a grounding sheet. So it has fine silver threads in it, and it actually plugs into the ground of your electrical socket. And it actually helps you discharge electromagnetic energy. So if you are really overwhelmed by electrical devices in the day, you spend a lot of time around electrically charged things, you live in a neighborhood with a big power set of lines out around you, that you can actually sleep in an environment that neutralizes that. And this is one of the things that seems to have an impact also on seasonal affective disorder. And I think the reason why it has the impact on the summer seasonal is because it is going to pull pollen out of the air for you as well. Probably even better than a HEPA filter, especially if there's enough ions there. So something to consider. Now, dietarily, that craving for starchy carbs and sweet things often makes you feel worse. So if you have a chance to transform your diet, people do find with SAD that dietary indiscretions can make it worse. So, we've had discussions about this before, like how do you actually make the best diet for yourself? And there's some evidence that more omega-3s will help in SAD. They improve serotonin levels. And things like that have tryptophan in them, like turkey and chicken, nuts, bananas, peas, pumpkin, and spinach, that those foods can actually improve neurotransmitter status as well. Again, we're just looking for things here that you could improve on, and every little improvement will often help make a much bigger improvement. Now, there's definitely some indication that exercise helps depression. Nobody actually really understands why, but there's a number of theories. One of the theories is that it's like this thermogenic hypothesis, meaning that you get an increase in your body temperature from exercising, and that itself is leading to a feeling of relaxation and decreased muscle tension. Mostly it decreases more anxiety more markedly. There's also an endorphin hypothesis that says that you're going to get increased endorphin release to improve the mood and the sense of well-being, but it's not been proven. And doses of naltrexone, which is an endorphin blocker, don't seem to block the phenomenon, so it's probably not that simple. It's also possible it just increases neurotransmitters. That actually hasn't been proved to happen in the brain, but it's been proven to happen in the blood. There's also a distraction theory where the exercise is distracting the person from the depressing thoughts. So exercise has been compared with other distracting activities like relaxation or assertiveness training or health education. The results have been inconclusive, but exercise is more effective than some activities for sure, and similar to others in its ability to aid reduction of depression. There's also a efficacy hypothesis that says that if a depressed person can engage in exercise, it strengthens that belief that you possess the necessary skills to complete a task and help you cope. And like I said, I've certainly seen this in depressed patients, huddled in a dark room, not exercising, not moving, not being exposed to light. There was a study that had an 8-week exercise intervention where there was group aerobic training 2 days per week. And that definitely improved depressive symptoms in milder SAD. In another study of employees that worked indoors in Finland, supervised exercise 2 or 3 times a week combined with the bright light exposure really was found to improve quality of life and mood in wintertime. So exercise really can't hurt. It definitely should be added to your regimen if you're suffering from SAD, even if we can't prove why. Now, there are some techniques in cognitive behavioral therapy where research has been shown that this is useful for treating seasonal affective disorder. So the goal in CBT is to change negative patterns of thinking or behavior, to just change the way that person is perceiving things. And there was a study that was published in the American Journal of Psychiatry that said it might even be more helpful for SAD patients than light therapy over the long term. And this, we made this reference in the very beginning slide where I said, there's lots of different factors here, and not all of them are just physical. It's just exacerbated by certain physical things for sure. So when you get CBT therapy, the therapist is helping you to figure out, like, what is the negative thought or what's the false thought? and to replace those thoughts with healthier and more realistic ones. So you're basically getting more aware of negative thoughts and learning how to replace them with more positive viewpoints. And if you're interested in that, let me know, because I have some great contacts for people that do that. Now, I also wanted to talk a tiny bit about herbal medicine that's a potential. Now, this is a hypericum plant. This is a St. John's wort. And hypericum has an absolutely amazing relationship to light. It is a plant, you can't really see it very clearly on this particular photo, but there's small red dots all over the flower petals of a hypericum plant. You can see there's a couple of little reddish details here in the stamens. And when you put hypericum flowers in oil and you set it in sun, the oil is this beautiful red color, eventually, not immediately, but eventually. And the hypericin is in this plant. It's a very light sensitive plant. It's actually a set of photosensitizing compounds that have the antidepressant effect in hypericum. So when you take St. John's wort in, what you're actually doing is you're putting in a bunch more porphyrin structures, really similar to the chlorophyll and the hemoglobin structures that we saw in the beginning of the slides. And so in essence, what you're doing is you're actually emphasizing light inside the body. So emphasizing the collection of light. And it is quite likely one of the reasons why this particular plant is so helpful under seasonal and sometimes just plain old depression circumstances. It does have a lot of studies behind it in general. It also has a lot of contraindications listed as a consequence. And sometimes it's a little bit frightening to people because it's one of the only herbs that probably has 20 listed contraindications. And just to clarify, one of the main reasons why that's the case is this is one of the very first herbal medicines that was ever taken seriously in science, where they bothered doing the research about it. And so they wanted to be very, very complete about it. And they wanted to show people that herbal medicine could also be dangerous. And so as a consequence, this herb has been studied so much, and they've tried to put it with so many different kinds of drug classes that they have often plastered warnings all over it. So you do have to be a little bit careful when you're using this with other psychoactive drugs. But ideally, you should be in consultation with the person who's prescribing those things when you're trying this. But it is, in essence, a photosensitizer. Now, I just saw that somebody was saying that they lost audio. If you ever lose audio, just press the reset exclamation mark there. And I can't type for the life of me. So that'll be the one that resets it. Sorry about that. Now, there's also a couple of other things that you can incorporate that have been shown to have an effect. One of them is gratitude journaling. So a gratitude journal can be particularly influential for those needing a boost. Oh, sorry, Carol, that's St. John's wort or hypericum. So that is the name of that plant. And sorry, just to go back to that for a sec, I mean, if you put that together, there was a 4-week study of 900 milligrams of St. John's wort, which was really associated with a significant reduction in the total depression scores. And it actually seems to take the place of the bright light therapy. So you can actually use it without the bright light and have almost as good of an effect as some bright light therapies have been in the past. So sorry, back to gratitude journaling. So gratitude journaling can actually help you feel calmer, especially if you do it at night. And again, just giving you a new perspective on what's important to you, what you genuinely appreciate in your life, what you want to have more of in your life, what you can do without, helping you learn more about yourself and becoming more self-aware. It's really important that we don't always just attribute every single blue moment or depressed moment to there being something physically wrong with your body that you can't do anything about. It's been shown that gratitude practices and mindfulness practices and meditation practices, things that we've been talking about over these last couple of years, and if you missed it, we did happy hour meditations for 64 days in a row at the beginning of COVID. So if you want to go back and see the recordings of some of those things that are up on Whole Life Medicine, learning how to do those things is also really important. And you need to be engaged also in actively trying to bring yourself out of the mood and not just get up and think, oh, I'm in a bad mood and it's just going to get worse from here. So it's really, if you can find the opportunity to engage in some of these practices or engage in CBT or try something to lighten your mood, like your light strategy. It's really useful and empowering. Now, another thing I thought I would mention is aromatherapy. So we did a whole course on this last summer that if you missed it, you can actually go and still take this course in aromatherapy. It's on the WLM learning site, which you can get to from Whole Life Medicine. And essential oils really do have a really unique ability. What I taught in that class was that there's really two main things that we use essential oils for. One is infections, and the other is mood. And it has a big impact on internal clock. So that's going to affect sleep and appetite. And you can use a diffuser to dilute a few drops of oil to infuse it into the air or inhale a few drops off a cotton ball. And bergamot and lemon oils are among the most widely researched for positive impact on mood. So there's rodent studies that show that lemon oil is an antidepressant and it's invigorating. It reduces anxiety. It boosts serotonin and dopamine, which are obviously we've already talked about in the context of depression and SAD. And in addition to lemon oil, there's things like clary sage, cedar wood, eucalyptus, but probably the citrus oil that's been most widely researched for mood is the bergamot. So if you use bergamot is the smell from Earl Grey tea. If you like Earl Grey tea, you'll love bergamot. It's a beautiful oil. And if you inhale it or get it on a diffusion or a water-based spray, you have really significant effects on all sorts of conditions. So work-related stress, reduction of anxiety, reduction of cortisol, reduction in self-reported fatigue and anxiety within 15 minutes of using it, changes in heart rate variability that kind of increase relaxation in studies. And there's lots of oils that are uplifting or stimulating, and then there's some that are calming. So it really kind of depends a little bit how you're feeling personally. But if you're kind of like low mood with not a lot of gumption, you can use things like black pepper and grapefruit, jasmine, rosemary, and then the calming ones are more the bergamot and the clary sage and the orange. Rose is lovely. Rose, though, true rose oil is very spendy. I love it. I happily shell out the $135 per milliliter that it is. Yes, you heard that right, milliliter. It's just the most beautiful oil, and I can't live without it, so I just roll with it. But there's some gorgeous oils that you can use to really have a big impact on mood. And they improve sleep as well. In our house, we often use spikenard for insomnia problems. If somebody's having trouble sleeping, we use spikenard on the temples. It's not the most common essential oil, but again, anytime that you can improve the sleep-wake cycle, you'll also improve depressive symptomatology. Okay, so I just wanted to note, oops, I forgot to change this on this top one here, but our next talk is going to be on concussion rehabilitation in late November. And we're going to do one on autoimmune challenges. Now, usually the December one is not at the end of the month. It's going to usually be around mid-month before people start getting crazy with having to do things for Christmas. And then in January, we're going to do Calm Your Anxiety. So we're going to kind of do a couple things that are brain and immune system and anxiety. And again, brain. Go back to brain all the time. It's my undergrad degree, right? And so I'm hoping that I'll see you there. I really enjoy doing these presentations for you. I'm hoping that you're getting things out of it. Let me know too if you have any questions about what we just talked about today. But if you don't, we can all go for a nice moonlit walk. Maybe there's just enough moon left to do that tonight. All right, take care, guys. Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.